Hello doctors, welcome back to our NEET MDS Recall 2021 series. So in this video of Recall series, we are going to see about an interesting condition, that is Ludwig's angina, from the subject oral medicine. So what is Ludwig's angina? So this is a very important question. It is a important university exam question, and also many MCQs arise from this topic. Okay, so it is a type of severe cellulitis involving the floor of mouth and is often caused by bacterial sources. So it is a kind of severe cellulitis involving the floor of mouth. So early in the infection, the floor of mouth rises due to swelling, leading to difficulty in swallowing the saliva. So it is an aggressive and rapidly spreading lesion, so hence it involves submandibular, sublingual and submental spaces bilaterally. Okay, so it involves submandibular, sublingual and submental spaces bilaterally, and it is also an aggressive and rapidly spreading lesion. So as the condition worsens, what happens? The airway may be compromised and hardening of the spaces on both sides of the tongue may develop. Overall, this condition has a rapid onset of over a few hours. So what are the causes? So the majority cases follow a dental infection. So this is very important for dentists. Okay. So other causes include parapharyngeal abscess, mandibular fracture, cut or piercing inside the mouth, and submandibular salivary stones. Then you can appreciate the images here, right? So the tongue here and the spaces involving like submandibular space, submental space, how the swelling is occurring in the throat. So the spread is like through the connective tissue. So the spread is through the connective tissue of the floor of mouth and is usually caused by infectious and invasive organisms such as Streptococcus, Staphylococcus and bacteroids. Okay, so involvement of sublingual space. So involvement of sublingual space leads to woody tongue, which can compromise the airway. So the woody tongue you can see in this image, so that can compromise the airway. And the submandibular space involvement. The submandibular space involvement causes enlargement on tenderness of neck above the level of hyoid bone. So enlargement, the tenderness of neck and enlargement is seen even here. It is seen in this image also, you can see. So this is cause what are called bull neck. Okay, so it will cause bull neck. So the main two important features, one is woody tongue, which is due to sublingual space, and the other one is bull neck, which is due to submandibular space. And then coming to the signs and symptoms it presents with. So it presents with an acute onset, so rapidly spreading. Therefore early diagnosis and immediate treatment planning is vital and life-saving. So the external signs may include bilateral lower facial swelling around the jaw and upper neck. Okay, so signs inside the mouth may include elevation of floor of mouth due to sublingual space involvement and posterior displacement of tongue, creating the potential for a compromised airway. So additional symptoms include painful neck swelling, drooling, tooth pain, dysphagia, shortness of breath, fever and general malaise. And along with that, patient can experience stridor, trismus and cyanosis. Okay, because when airway is getting blocked, so these are the important signs we observe. Then you can see your OPG here, right? So the OPG here, it is showing the involvement of the spaces of Ludwig's angina. So here you can see, you can appreciate it, right? So yeah, so what is it? So infection originating in the roots of the teeth can be identified with a dental x-ray. Of course, diagnosis, we need a dental x-ray, and a CT scan of neck with contrast material is used to identify deep neck spaces infection. So if it is spreading more, you can even go for a CT scan, but mostly with the dental x-ray and the clinical signs only, you can easily identify this. Then coming to the treatment. So for each patient, the treatment plan should be considered based upon the stage the patient is representing with. Okay, the stage of infection, airway control and comorbidities which are associated determine the treatment plan. So the four principles which we need to keep in mind during the treatment of Ludwig's angina patient is: sufficient airway management is required, Early and aggressive antibiotic therapy is required. Incision and drainage for any who fail medical management or form localized abscess. So incision and drainage is very important. And adequate nutrition and hydration support is required. So airways management, antibiotic therapy, incision and drainage are the key things which save life in a patient of Ludwig's angina. Along with that, nutrition and hydration support is also required. So here you can see. So the patient here is presenting with Ludwig's angina here, right? So this is the dental x-ray showing the lesion. So incision is marked, okay, for drainage. Offending tooth is extracted with drainage of pus. So first the offending tooth is extracted and drainage of pus is also done from the neck. Okay, so aspirate the culture and antibiotic sensitivity testing is done. Then corrugated drain is fixed. So this is the method how you do incision and drainage for Ludwig's angina. Okay. Then coming to the question they have asked in NEET MDS 2021 exam was, so it was a clinical question. So a patient presented with right-sided submandibular and sublingual swelling and left side submandibular swelling following toothache. So here itself we can say that it is presenting with bilaterally. Okay, so patient has high fever, pasty saliva, anxiety, restlessness. The tongue is elevated since last night with increased difficulty in breathing and airway is compromised. So most probable diagnosis is bilaterally involving submandibular and sublingual spaces. The striking answer should be Ludwig's angina. Okay. If you like our video, do subscribe to our YouTube channel. You can also follow us on our Instagram handles at Dogshala for dental content and at Dogshala Medical for medical content. You can also find us on Telegram. Thank you.